Hello and welcome back to another video. Today we're going to be talking all about golfer's elbow, but how it develops in tennis players. Now, a mistake I made when I was really young, I thought that golfer's elbow started because you play golf, or you get tennis elbow because you're a tennis player, and that's actually not the case. Now, golfer's elbow, or medial epicondylitis, is pain on the inner part of the elbow. So if you're standing with your palms facing forward, it's pain round about that area over there. Where tennis elbow is different. Tennis elbow is on the lateral side of the elbow, and that's called lateral epicondylitis. And you usually feel pain just above the elbow, just on the lateral side there in the extensor tendons. Golfer's elbow develops because there's excessive strain that gets put on the flexor tendons that attach onto the medial epicondyle, as well as the pronator teres muscle. And the pronator muscle is a muscle in the forearm. Its job is to pronate, rotate the forearm over. So the flexor carpi radialis brevis muscle, which runs along there, it's one of the wrist flexors, and the pronator teres muscle attached to the medial epicondyle in the elbow. And these can get stressed in tennis because obviously it's a repetitive sport, can cause overload of those tendons, and that can lead to tendinopathy and pretty severe elbow pain. The symptoms of golfer's elbow would be pain on the medial side of the elbow. You can also get pain referral down the forearm towards the wrist. So what are the main causes of golfer's elbow in tennis players? So it's quite common to see golfer's elbow when a player is just starting to accelerate the racket. So whether that's on a serve, the racket drops and then is about to accelerate, or on the ground stroke, when the wrist drops back into extension, the muscles in the forearm are contracting, so they're staying tight, but they're lengthening at the same time. And the modern forehand relies on what's called a stretch-shorten cycle. So that's as the racket's taken back and gets accelerated forward, that the muscles in the forearm stretch and then recoil like an elastic band, and that is what creates the wrist snap in the modern forehand. Now, many of the best players in the world make contact with the ball well out in front of their body, and you'll see that their wrist is in a fairly neutral position when making contact with the ball. If anything, it might be slightly extended, but it's not in full extension when making contact with the ball. And that is where errors with your technique or your timing can place excessive stress on those wrist flexor tendons. Because now if you're striking the ball and you're hitting it next to your body, it's quite likely that you're making contact with the ball with your wrist in an extended position, and that means that the flexor muscles in the forearm or in the wrist don't have the capacity to stretch further to absorb that impact. And what happens is that that tendon or those flexor tendons end up absorbing that load, and that can lead to breakdown of the collagen fibers in those tendons. Another factor that can contribute to the development of golfer's elbow is tennis racket stiffness. So the way you can measure, or the way you can find out what your tennis racket stiffness is by going online to one of the tennis shops like Tennis Only, if you're over here in Australia, or Tennis Warehouse, and have a look under the specifications, and you can see the stiffness rating of each racket. Now, some of the most popular rackets, which also happen to be the stiffest, it's a racket called the Babolat Pure Drive. It's very common amongst junior and professional players, and that's because it's a really stiff frame. A stiffer racket frame will give you more power, and that's because when the racket makes contact with the ball, the racket doesn't deform as much as a flexible frame would. Now, the downside to a stiff frame is that more shock and vibration is going to be transferred into the upper limb. And which muscles end up absorbing a lot of that load? It's the wrist flexors. And if you combine that with errors in timing or technique, and that's going to put a lot more strain on those flexor tendons. Tennis strings have evolved quite a lot over the years. Now, some of the early generation strings were made out of natural gut or synthetic gut or nylon, and these strings are very elastic in nature. And a string that's more elastic is going to be more forgiving when it makes contact with the ball, and it's going to deform a lot easier, and it's going to transfer less force or less shock into the arm. And then along came polyester strings, and these became very popular on tour because it gave players a lot of control, and that's because the string was really, really stiff. A stiff string is great for control, but the trade-off is that more shock or more force is getting transferred into the arm. And I remember back in the day, I had some yellow string in my tennis racket, and it was so stiff. Modern polyester strings are also referred to as copolyester strings, and these are made up of composites of different kinds of plastic or polyester. They're a lot softer now than some of the early generation polyester strings used to be. So you can get a copoly string that's a lot softer and it's more forgiving on the arm. So that string is going to deform a bit more on contact, and it's going to again absorb some of that shock, which means that the flexor tendons in your arm are not going to be absorbing that, and they're a lot more arm friendly than some of the previous generation polyester strings. There's a very useful little tool on the Tennis Warehouse University website, and that tool lets you look at how stiff a particular string is. I won't get into exactly how they test it, but at a glance you can have a look at any string you want in any gauge, and you can quickly see how stiff that string is in comparison to another one. And this might be something to consider, especially if you're struggling with golfer's elbow, or you've been playing quite a lot of tennis and you're feeling that pain start developing in the elbow. Have a look at your current string that you're playing with and compare it to some of the other strings on the market. What you can also do is consider going with a polyester string in the main, copoly in the main, and something like a natural gut or a multi-filament string in the crosses, and that can be a bit more forgiving. So it'll give you some of the control of a polyester string and this topspin, but it'll be a little bit more forgiving on impact because of the more elastic multi-filament string that gets used in the crosses. Chat to your pro shop about that and they'll be able to advise you more on good hybrid string combinations. Another big issue that I see happening quite a lot is old, worn out tennis grips. So if your grip starts looking like this, it's probably time for a change. The reason an old, worn out grip is quite bad is if it's lost its tackiness, you're going to be squeezing the racket handle a lot tighter to prevent the racket from twisting in your hand on contact. So a fresh overgrip or a fresh grip is going to allow your hand, your wrist to stay a bit more relaxed. You're not going to have to grip the racket as tight to stop it from turning. You can relax the grip a little bit, and again, that means that those muscles in the forearm are not working as hard and less strain is going to be put on those flexor tendons. Let's talk treatment for golfer's elbow. These treatment methods can be used whether you're a tennis player or whether you're not. The rehab and the treatment principles are still the same. So because we're dealing with a tendinopathy, tendinopathies respond really well to negative reps or eccentric loading, which is why we like to include eccentric loading in our rehab for golfer's elbow. Now, there's a useful little tool that we use to create that eccentric contraction and load up those tendons in the elbow, and we use a little rubber flex bar, and the exercise is called a Tyler twist. So the way you do this exercise is your bottom hand's going to grip the bar fully flexed. So you're going to hold it like that. Bottom hand's going to hold it upside down. Bottom hand is going to then flip this over, and you can see how the bar is twisting itself, and the bar wants to untwist. So because the bar is untwisting, this hand here is extending, but the muscles are contracting at the same time. So we'll do that again. Hold it over there, you flip it over, and then the bar is untwisting itself, but these muscles are still contracting, and we're getting a good negative rep in the forearm flexors. So you do a nice, slow, eccentric motion, about 4 seconds down. We normally start somebody off on 2 to 3 sets of 15 repetitions per day. And if they're finding that's quite easy and they can complete it without much pain or without a flare-up and symptoms the following day, we would then progress them to a heavier flex bar. Now, these make up the core of our rehab, and we would dose the rehab accordingly, increase it or decrease it depending on where someone is in their rehab stage. But 2 to 3 sets of 15 reps per day is a good place to start. One of the ways we treat golfer's elbow in the clinic is with something called Shockwave therapy. Shockwave works really well because it gets the cells in the tendon repairing and rebuilding those collagen fibers. It also can help deplete some of the neurotransmitters in the area that are responsible for pain. So overall what it does, it leads to an increase in collagen synthesis in the area, promotes the ingrowth of new blood vessels, so it increases blood flow in the area, and it also helps deplete the pain neurotransmitters. So essentially you're going to have less pain in that area, and that makes it easier to then do your rehab. Out of all the risk factors that I've mentioned earlier, the most important is biomechanics and technique, without a doubt. So I would always recommend working with your tennis coach, clearing up any issues in your technique. The role of the healthcare professional is to look at biomechanics and try to figure out, are there any issues in a player's kinematic chain? Are they lacking mobility in certain areas? Are they lacking strength in others? Because all this can cause a player to try and find power from elsewhere. So for example, if a player isn't able to generate enough power with their legs, or they're not getting a good leg drive on their serve or on their ground strokes, that power is not getting transferred up to the trunk and transferred through the arm. So what are they going to do instead? They're going to try and muscle the ball a lot harder, just try to swing harder using the upper limb, grab harder, squeeze the racket handle harder. And again, this can all put a lot more strain on those muscles and those tendons in the arm. We use a series of tests in our clinic, and it was developed by Racket Fit, and they're over in the US. This gives us a really nice overview of where a patient is or where a player is in terms of their mobility, their strength. Do they have the correct biomechanics to get into a good service position or to produce a good ground stroke? Or are they lacking mobility or strength in certain areas, and is that going to cause them to compensate elsewhere? So these are things that we look at as well when screening our players. It's possible you may have the perfect racket setup, the perfect string setup, great biomechanics, but your body needs time to rest. Tendons do need a chance to recover and repair. And if you're not giving them that chance to repair, they're going to become overloaded, and they're going to become painful and symptomatic. Every player's physiology is different, and the amount of load or training that their body can handle before an injury or pain occurs, it gets affected by external factors like diet, sleep, stress. So all these need to be accounted for when looking at the player and figuring out what external factors could be contributing to that ongoing issue. So thank you very much for watching, and I hope you found this video useful, and I will see you again in the next one.